Radar Croeso, welcome everybody to Health and Care Scrutiny Committee on the 1st of December. We've got a mixture of us being in the County Hall today and on hybrid on Zoom. So we will try and manage that as best as possible. We've got officers and members of the Health Board with us who I will welcome as and when we get to their items on the agenda. But thanks everybody for coming today. First of all, Connor, have we got any apologies, please?
Yes, Chair. Apologies from Councillors Richard Church, Cabinet Member for a Safer Paris, Councillors Edwin Roderick and Benjamin Breeze, and then Lynette Lavelle, Director of Education and Children, Jane Thomas, Head of Finance, Wayne Tannehill, Associate Director of Capital at States and Property from Paris Teaching Health Board, and then Councillor Elwyn Vaughan has said that he'll be late to joining the meeting due to other council business, and Nina Davis will need to leave about 12:15.
Thank you. I can see that Elwyn, I think, has joined us, and there's a couple of other councillors who have to leave sometime after 12, but we've established that we'll still be quorate. Item 2, declarations of interest. I'm aware of a couple. Please could you just mention now? I think Chris, yeah, please could you declare your interest?
Yes, thank you, Chair. Under items 10, 11 and 12, I'll need to declare an interest because I sit as the local authority independent member on Powys Teaching Health Board, and I've participated in some of those decision-making things by the board, so I won't actively participate on those items.
Thank you, Chris. And we've established that I'm happy for you to stay in the meeting, but
yeah,
for you to not participate.
Okay, thank you.
Nina.
Yeah, thank you, Chair. Just have it noted that I'm associate member of the Powys Teaching Health Board as well. Thank you.
Thank you. Any other members? No. Disclosure of party whips? No. Nina, your hand's still up. I don't think you're a party whip. Minutes from the meeting on the 3rd of November. I was not present for the first part of that meeting because I had another commitment. So hopefully you've all had a chance, and can I have to read those? Anyone got any comments? Can I have a proposer and a seconder, please? Thank you, Liz. Thanks, Chris. Have you noted those, Connor? Thank you. Okay, so first main item on the agenda is an update on the strategic risk management and the specific risks on the council's risk register. We have been provided with the detailed risk register, but we're just going to primarily focusing on the impact to children's services and adult services on this. I understand, is Bets Ingram online?
I am, yes.
Hi, Bets. Thanks for coming to Scrutiny today. I think Councillor David is online as well. I'm just going to hand over to you. Do you want to just explain to members of the public and also to the committee, please, that's what your role is in relation to this, and then just take us through just a quick highlight, key points of the risks that are relevant to social services, not all of the risks. So I know there's the WCCIAS, is that it, WICAS, and care homes ones, but if you could just focus it on social service, if that's okay, please.
Okay, yeah, I'll try, Chair. So yes, my name's Bets Ingram, and my official title is Strategic Equalities and Risk Management Officer. So my role in relation to risk management is coordinating and supporting the authority on managing risk management. So then if I was to take you through the report, trying to stick to just the risks that relate to health and care. So without doing it verbatim, you've obviously got the scrutiny report template.
Yeah, we've all read the report as well. So
right, so I can miss that one out. Okay, yeah. If I go to the main report, just highlighting a few key things. So of course, risk is all about being key to safeguarding the organisation and building resistance into our services. The advice we have given is to ensure a risk management approach to decision making and good governance of the council, and it's proposed that Cabinet review the progress to mitigating strategic risks and review the strategic risk proposals. So during Q2, there were 15 risks on the strategic risk register. The Appendix A and Appendix B have got a summary of those risks, with giving assurance that the mitigating actions have been actioned and monitored. So we can look at those in detail in a minute. I mentioned Appendix B, which is the heat map. That gives us a clear visual that 5 out of the 14 risks have probability of likely and an impact of major. 1 has a probability of almost certain and an impact of major, and 1 has a probability of likely and an impact of severe. So we can see during Q2, the risks that have changed their probability or impact. And in relation to health and care, I think if we're really looking at it very specific, just health and care, then I would be saying it's just the final one, which is if WCCIS is not fit for purpose, then it will impact upon our services' ability to carry out our statutory operational duties. And this one has gone up from major to severe, so a score of 20. It's not quite as clear cut as that, because you could possibly argue that the planned outages, will have an effect on our delivery to services, hence why the whole of the risk register has come to yourselves. Then the de-escalate, so which we're requesting that Cabinet de-escalate PCC 0008, which is all about the planned outages. And then I can move on to the end, which is a recommendation. Obviously, Cabinet note the current strategic risk register is satisfied with the progress against these mitigating actions and approves the de-escalation of that power outage risk I just mentioned. So then we move on to the actual Appendix A, where the detail of the risks are. So do you want me, Chair, to go through each of the individual H&C ones, or?
No, I think we've all read it. So we're aware of there being obviously the WICIS one, and then the social care provider one. And then obviously there's sort of more wider questions on the budget one and workforce related matters, which could apply to social services. But we do look at those issues in more detail at scrutiny anyway. So I think what I'm going to do is I'm just going to, if it's okay with you, open it up to members just to ask a couple of questions on what they've identified in the actual risk register, where they just want a bit more clarity on perhaps what you're doing as an authority to mitigate the risk. So Councillor Liz and Councillor Chris, I know you've got questions on the WICIS. Is that how you say it? Is that WICIS, or do you say WCCIS? Okay, WICIS. So Liz, did you want to ask your question about that?
Yeah, thank you. Thank you, Chair. I'm not sure whether this is for you, Bets, or for Nina, but it's about the mitigating actions in relation to the recording on WICIS. And, for the benefit of the public, if information's not recorded, then it can compromise the safeguarding of children and adults. And that's because if someone comes along and goes into WICIS because they've had a report about a child or an adult, and that information has not been entered, then that pattern of behaviour might not be able to be identified by the police, the social workers and the multi-agency teams involved in this. So one of the workarounds, the mitigation, is that more admin people are going to be entering data. So if the system's down, for example, social worker can't do it, an admin worker will enter that data to ensure that the system is up to date. Given the shortages in the labour market and the difficulties that we've got in terms of, general labour, can we have some assurance that there are enough people to do that and that is happening on a day-to-day basis?
I'm not sure who would like to take that question. Possibly Nina, I think.
I thought Nina, probably.
Diolch, thank you, Chair, and thank you, Councillor Liz, for your questions. I do have Sharon Fruin, and I think Sharon Powell is available online as well. So if you wanted to ask some, operational kind of questions as well about WCCIS, if it's okay, Chair, I'd be grateful for them to come in. But in terms of WCCIS, I mean, as you can see within the risk register here, it is a very significant risk, not just for the services, but also corporately, etc. And unfortunately, there have been times, quite a lot recently as well, where the system has not been working as it should. We do have access to read-only data, but of course it's the updating of new data that is a real issue when the system is not available. And you get a backlog then of build-up of information that needs to be put onto the system. What we're having to do is that people are having to put the information on at a later date, and we're having to actually pay people overtime to do that work now, because it's not been able to be done within normal hours, etc. So it is having a cost implication on the services now as well. So I don't think there's any problem with getting people to do it at the moment, Councillor Liz, but thank you for asking. But it is having an impact on service delivery and cost as well. But could I, if it's all right, Chair, if I could ask if Sharon if they'd like to add anything additional to that? Nothing from Sharon. Sharon Powell, is she online?
I don't think so.
Thank you, Nina. That's sort of answered for me, because I think the overtime is giving some assurance that people are doing it. I think the cost is probably something else that we're going to want to look at some point.
Yeah.
But thank you.
Yeah. I'm just going to ask a follow-up question, just because obviously this has been on the risk register for some time, and also whilst previous service heads were in place as well, and going back over a year, I asked previous service heads whether or not any people had been put at risk, and from memory the head of children said yes, there was an instance where, because they couldn't access what they needed to do an assessment for a child, there was someone who was put at risk. They were able to mitigate that, but she couldn't say that there hadn't been a risk. The head of adults basically said not yet. So my question is the same. Has anyone, to Sharon, I know Sharon Powell's not here, but has anyone been put at risk because of the system problems?
Happy to come in, Chair.
Yeah.
At this moment in time, no. We've been able to mitigate that. It has been very difficult in the last few weeks, because we've had outage on outage on outage. So whereas normally we have a day or a few hours, the last few outages we've had have been quite sustained. So that's been really worrying. A key risk area for us is over the weekend and out of hours for our emergency teams, and how they get, we ensure they get the right information. It hasn't been an issue to date, but it is a significant risk. There's no denying that.
No, and you highlight the impact this has on workforce morale as well. I think obviously you're looking at what's going to happen moving forward. So I'm going to bring in Councillor Chris. I think Chris, you had a question on where we're going with this then. And
yeah. I mean, I've raised questions about this previously on this committee earlier in the year. We were assured that there was going to be a new system coming in, and there was going to be different models or different options being provided. I see in the update that there was some meetings being progressed in November for a decision to be made. I want to know whether we've made those decisions, and do we have a new system that's going to be replacing it, and what's the timescales around that? Because bearing in mind the answers that have just been given to Councillor Liz, this raises significant more questions, particularly if there's no cost implications coming through to the service side as well.
Nina?
Yeah, thank you, Chair, and thank you, Councillor Chris, for your questions there. We will be moving to a new system that is guaranteed, and the timescale for that is looking likely to be Q3, I think, to 2025. I'm just trying to think. Yes, the current system that is being used comes its end of life then anyway. So everybody will be moving to a new system across Wales in that timescale. So an options report has been prepared and has come, and we're about to kind of go live with the decision on that probably next week. So apologies if I could just hang fire until that decision is made public, but we will be moving to a new system within that timescale. And Councillor Chris, you know, obviously we've got quite a period of time until that new system is in place. And what we are doing, you know, both within myself as a Director of Social Services, but also within our IT support team, we are escalating daily any issues and concerns with the current system. We following those up with the national team. I've also followed them up with Welsh Government and with ADSS as well, because you know, we will be using this system for a period of time, and it's very important that the focus on the current system and making sure that works is not lost while we move to a new system. So I just wanted to give you that assurance that although we are looking at what we are moving towards and what new system we'll be moving towards, we're also very aware that it's very important to make sure that the existing system is performing as it should be in the meantime. And we are looking, you know, at how we ensure that's happening. And sorry, I had one more point and it's gone right up my head. Please apologise. Excuse me, Chair. It'll probably come back to me in a moment.
Chris, did you want to come back on that?
It's okay. Yeah, I did want to just come back on it, if I may. Obviously, if the system's not going to be implemented, then the new option, and I appreciate that there'll be a report next week, which is welcomed. But if we're not going to be doing that until 2025, we do need to have some assurances going forward that there are contingencies in place which are not going to increase the cost implications of the system dropping out and putting potential patients and our staff at risk.
Thanks, Chris. I think, yeah, I think if I ask Nina to come back on that, because from what has been said before, it sounds like there are contingencies in place, but they do have cost implications. Is that right? Because we've employed someone to help with this. Is that right?
Yes, there are contingencies in place. Thank you, Chair, and thank you, Councillor Chris. But yeah, at the moment, there are additional cost implications because we haven't had to pay staff extra time, overtime, doing the data entry outside of their normal working hours because the system hasn't been available to use as it should be. So yeah, just we you know, and this is why we're escalating as well and looking at contractual obligations, etc., to making sure that we're pushing as hard as we can to ensure this system works as it should be. And I have remembered what I meant to say earlier as well, Chair, if I may, is that we have already started data cleansing, because when we move to the new system, you know, that's a huge process, as I'm sure you understand, the amount of data we're going to be transferring to a new system, and making sure that system is as robust and prepared to be moved is going to be really key to success of that transition project. So I just wanted to give you assurance that that work has already started and is progressing really, really well. So when the decision is made on the final product that we'll be moving to, we'll be really well placed to make sure that that transition happens as smoothly as possible, because that's really important, obviously, for everybody, but particularly for our staff who are going to be working on the system. Thank you.
Thank you. Just in relation to the cost impact then, does that mean when we see the budget papers for next year, there will be a specific pressure identified for both adults and children of the increased costs that are associated with dealing with this risk? It will be a itemised line on the budget as a pressure.
Thank you, Chair. Not at this stage. We're not anticipating that. I mean, the impact at the moment is small and minimal, and we would hope it would not be ongoing. So there is not a pressure at the moment. But of course, you know, there is no set budget at the moment. And so things might change, but I don't anticipate they will be at this stage.
Okay, thank you. Gareth.
Yeah, just one question. It's very high on the heat map at the moment. But taking the points that Sharon's just made about the number of outages recently, do you see that moving towards the top right-hand corner?
Thank you, Councillor Gareth. I must admit, performance has been really poor over the last few weeks. So I think that there is a likelihood that when we review this at the end of Q3, we will be looking at where this fits. And I think Sharon would like to come in, if that's okay, Chair.
Yeah.
Thank you, Chair. I just wanted to offer some reassurances that the IT team and the social care teams work tirelessly with the national team when we do get an outage to actually understand what it is, what we need to do to bring it back online as soon as possible. There's often some workarounds that are supplied so that people can get in a different way. So I think everybody our end is doing as much as they possibly can to make sure that we're back online as soon as possible. And there is a significant amount of work, to reiterate what Nina was saying, around data cleansing and making sure that we are absolutely good to go as soon as we've got a new engine to work with.
Okay, thank you. When you have the update that's coming forward, how will that be communicated? Will it go council-wide, or is it not that kind of thing that goes council-wide? But if so, can we get a specific update to our committee,
Absolutely, I can
please?
provide Scrutiny Committee with an update next week, and happy to do so.
Thank you. Chris, I think you had another general question on the risk to do with a cybersecurity attack, and just whether
Yeah,
or not that's an
it
impact on social services.
yeah, it's just to raise the question. I know someone may not have the answers, but I'm happy for it to come back just to have the assurances. Under ICT 0029 cyber issues, I just wanted to make sure, does the council have any systems that are utilising operating systems below the systems that are not now supported? So earlier systems, I'll mention one, like Windows 7, Windows 8, they're not supported anymore, but they potentially compromise a system. And I just want to make sure that we've got no systems that are not updated and running on current systems, because in other organizations they have been, and they've been the source of cyber attacks.
I'll put the question to them. It may be that's something that they need to take away with and come back with the IT department.
Yeah, thank you, Chair, and thank you, Councillor Chris. I'm afraid I don't know the answer to that, but happy to take that away and ask the correct department to come back with a response.
That's
Okay.
great.
Thank you.
Please. And the one on the scrutiny update on WCCIS. Councillor David, is there anything you want to add in general, just for us to be aware of as a committee, about your role in overseeing the risk register, and anything you want to highlight?
No, nothing in particular, Chair. It's the report obviously goes to governance and audit and the other scrutiny committees. So obviously it's thoroughly vetted and scrutinised. And I think this particular report will be going to Cabinet in early January. So obviously if there's any comments you want to include with regard to the report, they'd be considered then.
Yeah, I think we just probably include a comment that we would want to be kept up to date on the WCCIS system. In particular, I think that's our main concern. Obviously, there is an item at the end which is in confidential session where we may want to add to that.
Yeah, if I may, Chair, I'm a little confused in that, because I've got two reports here. Perhaps Bets can help me. But the report I initially had was referring to that closed session around risk ASC 0066. But the report that's on this agenda is referring to risk RCPCH 0007.
That's the one that I've got as being in closed session.
And I can't find Appendix C. Anyway, I've gone into the confidential members section. But has anybody been able to access Appendix C?
I've got a physical copy.
If I may,
send you it, David.
Yeah.
If I may, Councillor David, I believe Connor and I were waiting on a final confirmation from Rachel Evans, Head of Commissioning. We believe that that risk that's been referred to in the closed session has been resolved this week, and therefore is no longer a risk and has been closed. But Connor and I were waiting for full confirmation from Rachel Evans that that was the case. I don't know whether Rachel is here today or whether Nina is able to confirm, and that means that we obviously won't be looking at that risk in closed session.
I thought that might have been the case, but I just wanted some clarification on that. But if Rachel is here, perhaps she can clarify it.
Rachel, are you able to comment? Insofar as you can in a public session.
Yeah, morning. Bets, are you able to clarify that risk? I'm just struggling to see my papers at the moment. So that risk was in relation to, was it Powers Home Care Homes?
Yes.
Okay, yeah, I can confirm that that risk has now been resolved and closed.
Okay, I still think there would be a question I would like to ask about that in a confidential session, just so that we can have an assurance on why that's been closed and what's been done to completely mitigate that. But I will leave that for now because it is a confidential item. Is that okay, David?
Yeah, that's fine, Chair. Yeah, it
Okay.
actually that does clarify the situation for me, because I did believe that the risk it was referring to was the one that Rachel's just mentioned. So yes, we can have further discussion later. Yeah.
Thank you. Okay, so thanks Bets, thanks David for coming on this one. If you don't need to stay for any of the other items, please feel free to go. We're just moving on to item 6, which is the Corporate Safeguarding Board Activity Report, which is something that comes to us quite often. So I don't think we're going to spend too much time on this. I think if we can just have from Nina, please, just the really key updates and any points that you've done to address our previous actions. And I think, Connor, you've got a list of those actions, haven't you?
Thank you very much, Chair. Thank you. Yeah, no, I'll keep it brief because obviously this is quite a routine now that I come regularly to these meetings with an update. The report you've been provided with for today is an update on the Corporate Safeguarding Board meetings of the 4th of August and the 15th of September. As usual, as our board meetings, there's a real focus on the actions and progress against the actions on the tracker, where it was noted at that time that 9 actions were rated as green, on track, with 1 as amber, as slightly off track. That recommendation relates to expectation of contractors in respect of safeguarding training. There was a good discussion around that action, on the achievements that had been put into place, and also to identify the future actions against it as well. And those are noted in the report for you. There was a discussion around the annual safeguarding self-assessment audits. The board were informed that a dashboard has been created, which allows those actions to be monitored and progress tracked, and work was ongoing by heads of service at that time to update on their actions. The board were shown a presentation about the implementation of a tiered approach to contract management and prioritising resources for contracts, etc. There was also a discussion around channel and community safety partnership agreement arrangements, and it was agreed that relevant officers would do some work and come back to the December meeting with some proposals around that. Safeguarding theme of the month, the board were informed that spotlight on safeguarding communications have now started and are in place, with regular updates and communications going out. And also a reminder about the safeguarding conference that Powers hosted as well, that has now taken place with a focus on rural safeguarding. We also were informed of the White Ribbon Day and the walks that were held, which was now last Saturday. Reports by exception were received from housing, education, from regarding safeguarding training, from adult social care, children's, and we noted the future agenda items as well. Under any other business, the volunteering for Powers County Council policy was included for the board's information and noted that that had now been approved. Board were informed that 98.5% of members were compliant with safeguarding mandatory training with mitigating circumstances for the 1.5% non-compliance. And we also discussed a safeguarding vlog that would be provided to the board in December. The future meetings are scheduled for 14th of December and 14th of March. Thank you, Chair. Happy to take questions.
Thank you. Connor, have you got the list of what we mentioned last time? Where would I see that? Is it on this? Where would I see it? Sorry, Connor. On Zoom, if you go back onto the Zoom link. Okay. Yeah, so I'm just trying to find the item. Can we scroll down to I still can't see where they are. Oh, here we go. So we've got a request for the Director of Social Services and Housing to amend the link to the tracker, including in the report. Oh, I think last time we couldn't access it. Obviously my laptop's broken. Have members been able to access that this time? Anyone? Okay. I think. Oh, there's an update on that one. The request last time was whether we could go to the National Safeguarding Conference. I can report that Councillor Gareth and I both went. It was really well attended. If we'd like to put on record really how well organised it was some really innovative presentations there. Particularly, I thought the stuff that's going on to do with workforce in children's services was really eye-opening, and you know, it's good that we're sort of sharing best practice across Wales. And also we had a presentation from, I can't remember the name of them, I think it's She Is Not Your Rehab, the group that came from New Zealand, and the work that they're doing and have done abroad is just incredible. I wonder whether we could maybe have some, if there's anything that's come of that, are we able to be updated on that? As to whether or not there's something happening at Welsh level in terms of looking into what they've done abroad. Because obviously it was a great presentation, but there was a reason they were there. And so has that resulted in something else happening? And I think that's it, is it? Yeah.
Chair, I think I have provided a commentary and update on all of the actions,
have,
but if
yeah.
I haven't, please
Yeah.
let me know. But no, but I think they're all done. Yeah, thank you very much.
Thank you for that. That shows our tracker is working. Okay, so next item is work programme, which we're going to shift to the end, because Gareth and I have had a meeting with Connor about that anyway already. And so the rest of the agenda is proposed to go into confidential private session. I think it's really important that we make sure that we've got proper reasons for going into confidential private session for these items. So for each of these, could I please have an overview from whoever's the relevant person to provide these on why therapeutic attachment team presentation needs to be in private session, North Powys Wellbeing Hub needs to be in private session, winter pressures needs to be in private session, and the joint working sustainable model needs to be in private session.
Sorry, is Sharon Powell in the meeting to talk to the therapeutic attachment?
We can
Okay.
shift the agenda items around, because I can see that Carly is here from the Health Board. So
Yeah, in terms of North Powys Wellbeing Hub, we're going to be sharing you progress with the programme to date, but also there might be impact on potential staff and commission services providers within the presentation and the discussion that wouldn't be appropriate to be held in public session, hence the request to go into confidential session.
not appropriate because
It's not known by people who might be affected.
Okay.
So
it
that's why
impacts individual workforce members.
absolutely, thank you.
That's understandable. What about the winter pressures stuff?
I don't have an answer for that, sorry, Chair.
Is it that it's just the way that the agenda's been put and actually it doesn't need to be in?
It could be. I mean, there's a lot of data in there that's already out there in the public domain.
Yeah, Sian, have you got a view on whether it needs to be in?
I was surprised to hear it was in.
Yeah.
I wouldn't have expected it to be in private session, but I'm
think
happy to be corrected on that.
I think we're happy to do that one in
What
public session.
happens then, Connor, if we go in and out of private session? Is that possible? Okay. Does that mean, I know this is putting you a bit on the spot in terms of how you might have prepared for the meeting, but are you happy to move winter pressures to do now?
Yes.
Okay.
Chair, and I've just spoken to Powys Teaching Health Board colleagues, apologies for interrupting, and they'd be happy to do the accelerated sustainable model in public session as well, if you'd like that.
That would be great. Carly, you're off the hook for a bit. And we're just juggling around the agenda. Okay, so we'll do winter pressures first, and then the joint working one. On the winter pressures one, we've all read the report. Obviously, there's the same, not always the same, but they're very similar pressures as to what we would expect from previous updates before the winter sets in. So you don't need to go through it in specific detail, but if you could just do the highlights and where your biggest concerns are and what you're doing to mitigate those risks, but also where we're sort of an outlier in terms of not being the same as other or local authorities in Wales. Thank you, Sharon.
Thank you, Chair. Well done, Pam. As you said, Chair, the pressures are very similar. I think I would note that winter pressures we are tending to see as all year pressures now. So we're seeing an increase in demand and complexity all year round, and it continues month on month to outstrip our demand of care options and support options. The one thing I wanted to note, I know I was asked to provide specific details on hospital discharges, I think, and I wanted to provide an overview of the whole system, because unless the whole system works, hospital discharges are a part of a system that needs every option to work, I suppose. So we need a range of support options to make sure that we reduce admissions, maintain people in their own homes as long as possible, reduce delayed discharges and length of stay, and that often then delays the need for more enhanced care and support moving forward. You will have seen in the report that we did have significant amounts of people awaiting more timely assessments. I can tell, I'd like to give you assurances that we've begun to address that through some new operational processes. We've had some enhanced capacity through a managed agency coming in to give us a increased capacity, and we're hovering around 100 people awaiting allocation now, so a significant drop from the 300 odd that was in September, and we continue to drop from the number in as reported in October. Because of that, we've seen a delay in a drop in the number of people being delayed from discharge from hospital due to social work assessments. But it is important to recognise the uniqueness of Powys. We all know, we're all aware of the demography, but I think it's important to point out that we have a unique pressure on our social work teams and our health colleagues, because we don't have a district general hospital, so we're serving a number of hospitals on our borders, which actually disperses our resources and wears it very thin, just the amount of sheer travel time. Also, when we do go into crisis and escalation, it does mean we have to attend many more escalation meetings, and those escalation meetings are pivotal for us to manage the ebb and flow and make sure we've got our resources in the right places. We do have an issue, our outlying areas for as compared to the rest of Wales. We do have more people awaiting domiciliary care than most of Wales, and residential care, and we have a distinct lack of nursing beds in the county. You'll be aware of the work that Rachel and colleagues in commissioning are doing to develop those markets, and there's been numerous reports presented previously. We have seen that starting to reduce, and you'll see the numbers for October are dropping down, the numbers awaiting dom care. But I think it's important to note that even though in September of this year we provided more 800 more hours of dom care than we did the year before, we're still seeing that not meeting the demand. So we're doing more, and we're doing more complex work, but it's still not meeting the demand. Some of the things we're doing to mitigate that is looking at the way that we operate, enhancing our locality model so we've got the right resources in the right place at the right time, continuing to work with our third sector partners and our partners in the health board to develop our Home First and Reablement programme. We're looking to review the reablement programme to make sure it's fit for purpose, to make sure that we're actually making the most of the resources that we've got. Like I said, we've got increased social work capacity. We've been trialling some different roles in the social work teams and having discrete functions. So having officers dedicated to carers assessments, dedicated to hospital discharges, and that has seen a significant reduction in delays, which means that we manage our risk more effectively. We've also been developing our trusted assessor model, and we've got a pilot project in Tadridnod at the moment, where we've just signed off our data sharing agreement to get that up and running, and we're currently conducting, I think this is the first of a 2-week review of what we call a perfect week for discharges. So there's a number of us, so the third sector, our colleagues with in the health board, commissioning, social work, we've been spending time together this week to look at our discharge process and make sure that it's as efficient and effective as possible, to make sure that we're not meeting unnecessarily. We have reviewed our escalation process, and officers inform us that actually we're able to nip escalating issues in the bud far more quickly. We're far more responsive when we meet regularly. We have a continuous conversation rather than a conversation under pressure when we're experiencing conflict and crisis. We continue to look at the recent frailty project, and embedding the learning from that into our OT teams. We've had a significant increase in capacity in our occupational therapy teams. We've been doing some new work around online telephone assessments and triaging, and that has reduced our waiting list to the in the north of the county to under the 6-week target that we would like to set. So there's some of the unique pressures, some of the continuing pressures, and some of the mitigating actions, but I'm happy to take any questions.
I know there's a couple of questions. If I could just ask firstly, are you expecting then the trends to continuously improve given the extra resources that you've put in place?
Thank you, Chair. I would hope to see them continually improve. I would expect us to see a slight plateau of that through the next few months because of the winter issues that we face around respiratory illnesses and the like. But I would hope to see that continue to improve. I would expect it to plateau at some point, but I think the more continuous work we do around the third sector, especially around the social value forum and how we do things differently around our preventative agenda, that will be our next focus. So once we've ensure ourselves that actually we're developing the market in a way that we're happy with, that we've got our capacity within the assessment process where it needs to be, I think the next focus will be on prevention. But I would see it going up and down, Chair, I suppose, is what I'm saying.
This data on numbers of open referrals and delays, etc., is all in your monthly report.
Absolutely.
So I think, Connor, if you could please put this as an action for us as a committee, I think at the end of Q1, it would be good for us to have a look at the trends following, knowing what we know now and how that's gone up and down over the winter and where it is at Q1, just so we can see, you know, if there is hopefully a downward trajectory. My other question is, by mitigating, you're putting in extra resource. I'm already aware of the increased resource in the hospital discharge team, and we did have a working group meet with them last summer and hear about all of the things that they're doing. Is that increasing again? Presumably, if so, is there going to be a budgetary impact, or is what you've done already in the current budget? Was it already envisaged?
The increased capacity that we have at the moment is for a timely limited period till March.
Okay.
During that window of opportunity, we're doing some real enhanced work with the teams around data cleansing, looking at our operational processes, making sure they're as streamlined as possible, looking at our assessment process to make sure that's as effective and streamlined as possible, but also looking at the locality model and developing more robust links with our community connectors. Do we need to have local area coordination? So it's not about ongoing increased capacity at this point.
So you're not going to be asking for additional resource in next year's budget in relation to this?
Not at this point, no.
Okay.
No.
Okay, Councillor Highwin, I think you had a couple of questions, didn't you, on the figures and also on care companies?
Yes, thank you, Chair, and thank you very much for the report that you've just presented on this part of the agenda. It is pleasing to see the numbers from September to the 31st of October having reduced by 138 to be allocated to a social worker, and I heard you say this is due to operational changes, so that is very pleasing to hear. Just a few questions. Have we lost a care company in Newtown?
Just if the answer to that is of confidential nature, perhaps we could be provided with it in writing. And then maybe that they're not aware of the answer.
Okay.
Please, Councillor Highwin, I don't have an answer to that. I wouldn't be able to answer that.
Rachel's got her hand up.
Yeah, I am aware of that, and I would suggest that that's answered in confidential session.
Okay.
Perhaps
All
we
right.
can have an update on that then in writing, please, Rachel.
Yep.
Thank you.
And going forward, do we continue to seek new care companies in the county? But also, is there a need for a restructure or with these companies whereby they focus on a locality? So, for example, Newtown, the care providers literally focus on Newtown so that they reduce the mileage, they reduce the time traveling. Obviously, I'm also aware we've got residents out in our rural communities that will need addressing. But, you know, what I hear is that carers travel from Newtown, say to Carno or Llanidloes, back to Newtown, back to another outlying village. I'd like some thought to be given to that about focusing on town areas. And then the other thought I had was some of these residents, you know, they may only have a one visit per day. And can we not, in order to support them more fully and to aid their recovery, can we not utilize the day centre services more? I am aware that we're still in an engagement with the day centres right across Powys. I know that's ongoing at the moment, but I'd like some thought to be given as to how people returning home from a hospital visit could be better supported, not just with a care package, but then maybe reducing the care package from 2 or 3 visits per day down to 1, but incorporating or utilising our day centre services as well.
Thank you, Councillor. Rachel, are you able to come in on the care provider queries?
Yes, absolutely. Thank you, Chair. Yes, you're absolutely right. And those are really, really good suggestions. And I just wanted to provide some assurance around some of the work that we're doing in commissioning at the moment. So we currently have quite an extensive programme of work called Transforming and Modernising Domiciliary Care and Direct Payments. And actually, one of the areas of focus is around developing that locality patch-based approach, which looks at commissioning domiciliary care in a very different way that focuses on a locality and enables staff to be able to work within that locality. It reduces some of that travel and downtime. Yeah. And we've been working very closely in conjunction with providers in order to understand whether that would work and whether that would attract the workforce in a better way and actually provide some more efficiencies in terms of how that would work. And certainly we've had some really good, strong feedback that type of approach is really favourable. So we're working up that model at the moment just to understand and be able to trial and test that approach to see whether that would provide any additional benefits. So that's certainly part of that programme of transformation. In terms of attracting new carers to Powys, absolutely. I think that, you know, as we know, it is really challenging in Powys because of the rurality. However, we have got what's called a Meet the Buyer event scheduled to take place in the next couple of weeks, and that provides the opportunity to meet with potential new organisations and to try and attract new organisations into the market and onto what's called our dynamic purchasing system, which is our mechanism to contract with those organisations. But yes, we are running those events in order to try and attract new providers. The challenge often is, however, is that sometimes you have new organisations moving into Powys, but they draw on the same workforce. So, you know, a key aspect of that is also trying to attract new staff into working into care. Otherwise, you often see that, you know, staff move from organisation to organisation and it doesn't necessarily solve the problem. So it's a combination of approaches.
Thank you, Rachel. Thank you very much indeed. And it's pleasing to hear what you just responded with. Thank you.
The day centre part of your question, though, is someone able to come in on that, Sharon? Yeah.
Thank you, Chair. And thank you, Councillor Hyland. I couldn't agree more. The importance of making sure that somebody's connected back within their community when they return from hospital is absolutely pivotal. And I think the work that we're doing around the engagement and developing our locality model is pivotal to that. The fact that we need to have that what matters conversation with the person and identify where we could actually connect them with existing groups, new groups, whether that be that in the community or a building or a day service is absolutely essential. So that is something that we would be doing anyway. Collecting that data then around any needs would help us then inform the conversations we have with our commissioning colleagues and our third sector partners about what we need to grow in the area if there's anything missing.
On that point then, obviously you're partway through this day centre engagement period at the moment. What are you doing to specifically target finding information in relation to this? Because from what I understand, I know that the one in Welshpool was attended by third-party organisations, but there weren't service users that went to the physical meetings. How are you going to gather the information from potentially the health board, OT, to ensure that you're seeing what opportunities there are for outpatients and also getting people back into their communities through the day centre engagement exercise?
Absolutely essential that we're talking to everybody. I think some of the conversations we're having are on multi levels. We are discussing with people who use services and are being supported. There are discussions that are taking place at our operational team meetings to gather that data. There are discussions that take place with our meetings where we interact with our health board colleagues. So we're having those conversations in our Live Well partnership, and I'm sure they're happening in Age Well as well. And actually, I think part of the work around looking at our systems within the assessment teams is around capturing that data, having those resources, combining the information that we've got in Dowis and Info Engine, and making sure, and then I'll work with our community connectors. And I think we'll probably end up looking at some kind of redefined role around local area coordination. So there is that linchpin in each locality.
So when the day centre engagement stuff comes back to scrutiny, which will be pre-decision making, but you'll have then what you've gathered and then the various options you're considering, we'll be able to see all of the avenues of the engagement.
Absolutely.
Do we have a time frame for when that? I know obviously the engagement is going on at the moment, but do you know when are you looking next year to start looking at the options? that follow on from that?
So the timeline for the engagement regarding collate, I think they're going to start collating the information around the end of January.
Yeah.
With a view for recommendations shortly afterwards.
Okay. Councillor Shan, sorry.
Can you hear me? Do I need to unmute
Yeah,
on the
I think so.
laptop as well?
Can members hear Councillor Shan?
Do I need to unmute on the laptop as well? I don't know, sorry. I should know by now, shouldn't I? I just wanted to come in and make a brief point, which is it's not an engagement about day centres, it's an engagement about day opportunities.
Yes.
So it's a broad, much broader conversation. Obviously, day centres is a really important part of it and what they do and what they have done. But it's a much broader look at what makes a good day for people. Who were we before we were in this situation? What fired us up? What motivated us? What made a good day for us? What do we find pleasure in? What gives us purpose? What makes us feel fulfilled? So it's exploring all of those much broader pictures really to see what a system that enable people to live that good life as individual people, whatever those components were for the individual, meets those needs. Yeah, so Sharon has mentioned the local area coordination model, and I think the really key thing to know about that is that the linchpin person in each community. They don't just signpost people to what's available already. They work with that person to find if there are gaps, which mean that the components of your good life aren't there in your community, or there are gaps that are missing. They work with that person to see whether there's an opportunity to build that into the community provision, whether that's through working with people who are like-minded or working with community groups that are already there. So it's a very organic, dynamic sort of process that enables us to build our communities so that they meet needs. And it might not be a service provided by the council. It might be voluntary groups, or but it's about looking at that and in a very individual, place-based way.
Is April a potential time for it to potentially come back to scrutiny? Day opportunities?
Yeah.
Rachel, is would April for our work programme for day opportunities options, just because I'm conscious that we've got all of the budget stuff in the first few months next year, but I don't want to lose sight of this.
Yeah, apologies, Chair. It looks like Rachel's unavailable, but we'll certainly take that outside
Yeah,
the
if we
meeting
could
and
have
agree
that
a
noted
date.
as a point for us, please, Connor.
No, absolutely. Thank you.
Oh,
No, it's not.
members, are there any more questions on winter pressures? No. Okie doke. So I think we're just going to do the joint working accelerated sustainable model in public session as well. The lights have dimmed. Bit of ambience before we get onto this. Am I right that Hayley and Claire, you're both going to be leading on this? Welcome to Scrutiny. It's nice to have you here, and thank you so much for coming and making the effort to come in person. I really appreciate that, because we've not met before. And I gather you've got a presentation on this new approach that you're bringing forward. So I'm just going to hand over to you. Is there going to be input from council on this as well?
I'm happy to make a couple of comments afterwards, if that's okay, Chair.
Yeah, okay. I will hand over to you then. Do you want to, sorry, do you want to just explain your roles as well for the public and
yeah, no problem. I'm interim chief executive Powers Teaching Health Board, and thank you very much for inviting us today to talk about this for the committee. I think that the first thing I want to say, just in terms of introduction, because Claire will take us through the presentation at a high level, is that, you know, we've got a shared challenge across public sector services in Powers to deal with, both from the point of view of the demands on services, some of the workforce challenges, and in particular the financial issues that we're dealing with at the moment. So this piece of work has been born out of the very early work that we did in 2017, pre the pandemic, on our long-term health and care strategy, which set out a very clear vision of how we need to work together across public sector services, health and care, and that very strong focus on well-being as well as the services that we deliver. The position around this work is that it was established and very early days really still, and we'll share where we've got to regarding the work. But in the context of this, just wanted to share two things really. Firstly, obviously you've recently appointed your substantive chief executive in the authority. Both Emma and I have had discussions, and we've got now in place a joint executive team which brings us together on a much more formal basis to make sure that the work here, that we're looking at it across the whole system, not at an organisational level, because we could be making decisions as separate organisations that has an impact across the wider system. And also we've agreed that we'll be doing further discussions about how does this piece of work fit with the work that you're leading as an authority around a sustainable Powys. So I think I'll hand over to Claire to take us through the work and where we've got to, if that's okay. But I think on that latter point, I think it's very early days, so I'd really welcome the views of the Scrutiny Committee about how we can further develop this approach going forward. Thank you.
Thank you.
So I'm Claire Lyons, I'm the Assistant Director for Transformation and Development.
Sorry, do you want to start that again?
Sorry again. So I'm Claire Lyons, I'm the Assistant Director for Transformation and Value in the Health Board. Connor's very kindly agreed to push the slides through because they were circulated in advance. I'll do them at a high level, but conscious that we're doing this in the public session afterwards. So as Hayley said, we've this piece of work started actually about a year ago when we were seeing the unprecedented pressures that we were facing. You know, the once in a century pandemic, but then followed by the war in Ukraine, the inflation going up to 10%, everything we were seeing in terms of the pressure on ambulances, emergency department, delays in hospital, and the need for us to get together to ensure we have a sustainable footing going forward. Nina and our chief exec at that time, Carol Schillerbeer, chaired a workshop in the health board in County Hall in April, and colleague Councillor Sean Cox and others all present. And we had a wide group of people from communities, the sector, ambulance services, shop doc, local authority colleagues in social care, really considering this issue about how we go forward to achieve sustainability. We're very lucky because we had two people who are very influential on the national stage on these matters. So, for example, Hilary Cottam, and this exactly what Councillor Cox was just describing.
Is that Radical Help, Hilary Cottam?
Yeah,
I've read
really
her book.
focusing on what matters, connecting people to their local communities and the power of that, together with Richard Humphreys, where again, taking the long-term views on the situations we're facing, you know, considering how people have to plan differently for their own life. When we talk to you in a minute about aging, multi-conditions, this is about giving people the information that helps shape the decisions they need to take about where they live and those sorts of issues. Also, new forms of housing that might be needed, you know, to think radically and different about what we're facing. And Powys is absolutely at the forefront of this, and we're going to discuss that in a moment. If we could go on to the next slide, please. In terms of, I'm just going to put this onto slideshow myself because it's a bit hard for me to read the distant version. So if we could go through to the slide that is the key messages from the discovery stage. So we're doing this work in 3 stages: discover, design, and then we will be focusing on delivery. But we've had to accelerate some of the delivery alongside, particularly around frailty and the services we need here. So many in the room will be very familiar about this and online. But we have Powys is actually at the forefront of an ageing population. You know, as the census showed, 28% of our population already over the age of 65. Globally, people understand that as a country for Japan, they're at that level. we are already at, we're a county, they're a country, but we're already at that level. And we've got parts of Powys where a third of the population is already over the age of 65, if you think of areas like Crickhowell. And with that goes inevitably an increase in the numbers of people who have cancer, respiratory conditions, dementia, all these things. But crucially, what's changed is they don't have just cancer or just a heart condition. People have multiple conditions at once. And this changes the evidence base, it changes how we need to respond. It can become very difficult for people when they've got multiple different appointments, different medications, some of which are not working well together. And there's a job to really get into streamlining how this is working for older people. On top of that, it's the cumulative issues in Powys. So the sense, we all know most highly rural area in Wales, we know the areas we've got with deprivation, but a third of our people living alone. And that is huge when we're thinking of the age of our population, the number of people already who are living with multiple conditions, and a third of them living alone. And that influences what we're able to do in the home and how resilient people can be. Aging workforce, which we know about, and excellent work underway about encouraging younger people into health and care. But it's a declining number in the population. So we've got to think more about how we're supporting older workers also, and how we're helping to retain them. With colleagues in social services have already described home support's crucial in this, and the need to think creatively, the work that Rachel is doing, this focus on localities, all that matters. And we need to be working on, particularly, as we'll explain it in a moment, more flexibility in support workers, particularly in the last year of life. So we know about the issues with waiting times. One of the key pieces of learning from the pandemic was 60 million people learned how to do a lateral flow test in their own home and get the results on their phone. So we don't want to put back into centres things that can be done in people's own homes, in primary care, in the community. So one of the bits of work we've been accelerating, for example, was community cardiology in Powys, because cardiac issues are going to be very big going forward. We'll show you those stats in a minute. And so we've got a GP with specialist interest. He's actually one of the leading voices on this in Wales. We've put a new service in place in Newtown. We're in North Powys. We're rolling out. The echocardiograms are now being done in Powys. And of the patients he's seen, we're early days, but it's something like 340 patients. Only 15 needed to go on to a DGH. We put in anticipatory care plans for them. So it means that you're also helping to reduce unscheduled care, because you've got a grip of that person's cardiac situation early, and you've got a plan in place. And that's really how we're trying to work. Part of this work was also discovering and trying to pin down, when we looked just at our general wards, so not specialist wards for older people with dementia, I'm said in the 40%, but it was actually 38%. 38% of the people on our wards already have cognitive impairment on our general wards. So again, these multiple conditions, but of which cognitive impairment is part, because again, that's about people's ability to return to their own home, and how we connect them. And then many of you will know this already, but when people die in Powys, they die predominantly in hospital, and actually predominantly hospitals beyond our border. Now, for something like cancer, there is a very a much better choice in terms of what might be available to you. But if you've got something like chronic heart failure or multiple conditions, so actually you're not fitting our siloed boxes at the moment, how do we enable more choice for people who have multiple conditions. And then, you know, all of that is, you know, driving the need that we're all trying to deal with. If we could just move on to the next slide. We did a lot of work looking at GP registers, working out what we were facing, but we were saying actually this is really hard to forecast because our population is not growing, but it's aging. And I just want to, and then alongside this, new information became available in England and in Wales. And actually the work we did aligned with this really well. But, you know, because the population is aging, so not an increase in incidence, we're going to see huge growth in things like diabetes, the cardiac and other areas. So if we just go to the slide, which is the impact on spending, I'm afraid this is a health service because this is what we had available to you. But if we think, right, a quarter of our population already over the age of 65, and you look at the age 66, and this is the Office of Budget Responsibility, and it's showing you how costs climb with age. And that's what we're really tackling. So, you know, what we're doing is about trying to turn the curve because this is what is already baked into our population. If we moved on to the workforce projections, I won't dwell on them, but, you know, Rachel, Nina, others have been sharing information we've been sharing across. And, you know, it doesn't matter which part of the workforce you look at, including third sector, social services, health, we're facing the same issue in terms of our ageing population and ageing workforce and needing to adapt to that also. If we move to the model, as Hayley said, absolutely grounded in our health and care strategy, which we worked on together, but always about, we've got a more fundamental shift to do for prevention. So if you look at those diabetes figures, you know, what we're doing intergenerationally, young people through age well, start well, and live well and start well. But this is about key to sustainability is how we improve people's chance of living their best life at home, connected to what matters to them most. Exactly what was said by colleagues earlier on, and that's the heart of the model, as well as doing everything we can to always keep shifting to prevent the crisis emerging and enabling people to live at home. We just moved on to the next slide. This is the Welsh Government work, but actually the enhanced community care model, but it's absolutely, we've been working closely with them and it absolutely aligns to what we're trying to do. We've got areas where crisis intervention in the own home, in people's own homes, is really well understood. So crisis resolution home treatment teams, dementia home treatment teams, but actually for things like frailty, frail older people, we haven't got that way of working in place yet, where we're working together to prevent the crisis, to prevent people, and indeed to respond to a crisis that occurs, to prevent the admission to hospital in the first place, and everything that vicious circle then sets up. So just moving to the next slide. So a leading edge frailty service is key. We've had to accelerate this. We've got new people starting this winter, new allied health professionals, new healthcare support workers going in. But also we've got a professor who will be starting, who is a leading voice and experience in this field, because this is where Powers really needs to be at the top of the game. Shift to prevention, adapting to how we work with multiple conditions, and that's really about the join up of physical health and mental health. We've got, you know, when particularly for older people, they'll have the multiple conditions, but actually the greatest inequality of all is the physical health needs of our mental health patients. And we've really got to address how, for example, we're dealing with their cardiac health. Dr. Anna Woodall is doing some work on this at the moment, because when, and actually that might influence the rest of Wales. So again, something Powers can really lead the way on for our ability to join up. So tiered approach, proactive, person-centered, no wrong door, really this home first ethos, this recovery rehabilitation ethos, not getting stuck, you know, we've got strong focus on different ages, but we mustn't lose the intergenerational solutions also. You know, when we're talking, whether that's things like prevention or indeed befriending, if we've got young people finding it difficult, for example, to get into work, young people with learning disabilities or mental health issues, well, actually, they can be a key part of the solution on loneliness and befriending if we work together on that, really using the technology. But there's also something about powers prizing generalists, because all the subspecialization in roles is what makes it very difficult to operate when we're talking 100 miles, you know, no DGH. And therefore, you know, we've got to be proud of our people who have general roles and really help those develop, instead of going what is really driven by DGHs, which is this much more specialised and looking just at particular parts of the condition. And as I say, learning to how we return and support older workers. So I've just put the frailty model in there. And I have to say, you know, we've got colleagues in the local authority, third sector, our cluster leads are passionate about this area because this is what they deal with. When we've started to talk to people about this, this is what families are experiencing also. And again, this tiered model. So, and that's got to start with awareness and prevention. And there is a huge role for, you know, regional partnership board in this sort of area, because people, you know, got pretty good understanding actually of cancer, diabetes and things, but frailty isn't understood in the same way, and people aren't aware of it in the same way, and they're not aware of prevention in the same way. But we've put the numbers that we're facing there already, and you've seen the growth. So how we work together on this, you know, it is a bit of a Venn diagram, because your sustainable powers covers everything that you do as a local authority. And for us, Better Together, there's this huge important overlap and working together with the local authority, but also other partners such as the third sector are key in here. But for us, by the time we're talking also in this model about our theatres being sustainable, and our, you know, some of our more complex diagnostics being sustainable, key to that is actually also our relationship with other NHS bodies, and, you know, things like making sure that image sharing really works, so that people don't have to leave where they are and their images can be shared without the people being traveling. And something that's becoming more to the fore is we're still going to need the help on clinical governance, and it's some of those softer things that have got to be shared regionally. You know, we don't have the consultants that other people have, and where we still need their input in clinical governance terms, that's what we need the hospitals beyond the borders to help us with, and that's a change in mindset for them also. So this is the bit that is still a discussion, but, you know, we're all saying the same thing: shared geographical footprint. It will require more discussion, but it's got to be tiered, because there are some things that we can only do at an all powers level. You know, if we appoint a clinical lead for frailty, you know, we're lucky to get one professor. We can't have 13 in 13 localities. Things that will be north-south, things that will be on the 4, things that will be on the 13, and then we can start really working out how we share, you know, and work together around that. So the Venn diagram, you know, it requires more discussion. This is just illustrative. The RPB needs to be really strong in this, and there is much more that we could put into that partnership domain. Really clear about the things we need to work on together, and then clear about the things we've still got to influence with other NHS partners. So our next steps are continuing to accelerate the things we're accelerating, and Joy chairs our frailty and community model work in urgent care, and we had a meeting yesterday, and there's a lot of exciting stuff happening. We've got work on our diagnostics and theatres and admission avoidance. And then mental health, we're not quite where we need to be yet, but that's a key area, and we're going to make sure that, you know, it's one programme that we're all around the table with, linking properly to our mental health partnership. We need to build this into our shared plans, you know, rooted in the health and care strategy, clarify the Venn diagram, and then, you know, it's one conversation with our communities. I don't mean once, only speaking to them once, but I mean speaking to them in that joined up way.
Thank you, Claire. Can I just, sorry. Thank you, Claire. Just wanted to say that's a summary of a huge amount of work over the last year. And there are sort of detailed papers that sit beneath this with another layer of detail. But just on the last point around engagement and communication, how we do this with the public in the context of health and care, and also that wider public sector offer is really important. So that point around the geographical layered approach that we've got, there has been some active discussions to get us talking in the same language with the public around how we describe our offer within Powys. And it is a work in progress. And I hope from today's session, this discussion, we can, you know, take the comments on board and sort of build it to the next iteration of work that we're doing. So I hope that's helpful. Thank you.
Thank you. Nina, have you got anything you want to add from your perspective?
Yeah, just to kind of reiterate really some of what has been said. It's, you know, the health and care system is one system, and we do have shared challenges in terms of budget and workforce and demographics here in Powys, etc. So it's really important that we do come up with those shared solutions. You know, a sustainable Powys obviously is a lot wider than just social services, but a key element is social services, and working with our colleagues is absolutely key, and working with our RPB partners as well is really key, because, you know, we don't have all the solutions just between our two organisations, and it is going to need a community kind of solution and approach as well. So that's really important. So yeah, just will give you assurance that we're working together on the opportunities, an absolute focus on prevention, home first, person centred, rebalancing, etc., digital and technological solutions, place-based planning, absolutely key as well, looking at what assets we have between our organisations and how we can make the most of those and share those, and etc. I think there's opportunities there, and I think we've got a January meeting lined up to look at that in more detail, and agree with the comms and engagement. And we met yesterday as well to further discuss that and progress that. So just quickly wanted to give you a little bit of assurance on that. Thank you, Chair.
Okay, thank you. Members, have you got some questions? I can't see any hands up, so I'm happy to kick things off. Thank you so much for the presentation. Firstly, I'm really pleased to hear that you're already at the delivery stage, because as you said yourself, stuff that was identified in the discovery phase is not really new information. So I'm glad that things are being fast-tracked. I've got quite a few questions really on this Better Together slide in terms of how that will practically look. Just as an overarching question, I presume the work you're doing on this would feed into other projects like the North Powys Wellbeing Hub in terms of how they can deliver some of that there.
Absolutely. So Carly's in the room, but we absolutely have been working together so that the overarching models we're looking at for the whole of Powys are then things that are taken into the modelling for delivery in North Powys. So absolutely.
Okay, thank you. I was really pleased to hear you mention Hilary Cottam. I know from her perspective, she's keen on relationships, community, upstream thinking. Sounds like that's all embedded in this. On the first bullet point, the leading edge approach to frailty, and you mentioned of this commissioning a professor, how will you feed that into from your end to Powys's end? Because I would have thought that would inform things like how we do adaptations in properties and how we actually deliver that.
So the programme board that Joy chairs and Adam Grenno has been part of that as the local authority. But again, we can keep working on who needs to be where. But this is. So this isn't neatly done, because we have had to twin track. We've had to be working on this, but as you have said, things that we knew we just had to get on and do. So we've been working, and we're also in the situation we're in, having to sew together different bits of funding and different bits of opportunity. So the clusters have funding. So what we've done is agreed, based on the evidence, what a leading edge frailty service needs to look like using National Institute of Clinical Evidence. So the professor's not going to come in and say something different around that. We know in Powys we need a more primary and community oriented model than areas that have got district general hospitals, and the evidence base supports that. So what we're doing is working with the clusters, working with the local authority, working with the RPB, because the further faster funding will go through that source, and then working with the professor. He will be helping us shape things like complex geriatric assessment. How can that actually be done in Powys? You know, who can contribute to it? How do we make it more of a one-stop shop to stop all these multiple appointments and multiple medicines? So it's not neatly sequential, but he will absolutely feed it in. But we've had to start, and he's starting this winter, but we've had to start without, you know, part of the delivery was securing him.
Okay, thank you.
And can I just say he's not commissioned.
Okay.
He will be employed.
He's employed.
But
Okay.
part-time here in Powys.
And he's paid for by?
Powys Teaching Health Board.
Okay. The no wrong door, again, I mean, that's absolutely what's needed. But how do you ensure that that happens in practice, so that when people go to wherever, they're not just said, oh, sorry, the computer says no?
Yeah, so not easy, but this again is about the intergenerational thinking. So that's a very well embedded concept in mental health in children, but actually not so well embedded in for older people. So we talked to the Start Well partnership, for example, about sharing the learning across about how no wrong door does work. I mean, you've got a lot of experience of this as well.
I think one of the things I've learned as I've, years and years in my career, is that we used to have this ambition of a single front door. Do you remember those days? And I think we've come to realise now what we need is probably a number of front doors, but which are all connected, and so that we handhold the client, the patient, the individual, the citizen to the right place at the right time on their journey. And so if I just give the example of mental health, we've recently, back in April, set up 111+2. So at any point, 24/7, 365, a citizen in Wales can think, I'm struggling with my mental health, ring 111, go through to press 2, and we'll speak to a clinician in their local area. And so we've got Powys people, parish practitioners on 24/7. They will then deal with the immediate crisis or the immediate issue which concerns an individual, but then we'll go a bit further and we'll then link them up to the next step or the next thing which is important to them to help them respond to their need. So it's replicating that sort of model, not necessarily the same way of doing it, but a different way of doing it, but the principles about wrapping support and assistance and information around the individual and guiding them to the next step, and not saying, or Councillor Sean, you'd be better off going to yoga next Thursday. It's about then actually trying to see Councillor Sean's needs for mobility, her needs for support, and wrapping around that support and encouragement to get someone to exercise classes, to walking, to mobilisation, whatever it is. That sort of approach is what we need to do.
If through that conversation with, say, the mental health team, though, it's identified that they potentially need to be assessed for support in their home from a social perspective, how then would that then refer to the correct front door for that?
Yeah, so then we link back to Assist. It's still called Assist, isn't it? Yeah. So we link back to Assist. Referral we will do for that individual. Send an email, send a referral, give the client the information, the number, email them information and resources. So also it's not just talking to an individual, but we can also send resources by email, by post, leaflets, information, guidance, and a lot of online materials as well, self-help guides, etc. So that's how we're linking up the whole system just through one system.
Yeah.
And the devil in the details, linking up those complex systems right across the health and social care.
And that
world.
didn't exist before. No. And then you mentioned obviously the yoga example, but how do you gather intelligence from so many different rural local communities where there are, I've got a knit and natter group in mine and coffee mornings, and they are absolutely key to preventing rural isolation, but there are many people that aren't aware of them. How do you gather that intelligence to pass on?
So this is where we work hand in glove with Pavo. Info engine's really important, or Dewis interface now. And as part of this way of working, community connectors are in and out of, say, the 111+2 call centre, keeping people up to keeping those practitioners up to date with what's out there, talking with local government, talking with all manner of agencies, sports clubs, local stuff on the ground, and we also connect people back to their local community connector as well.
Okay, so they call you as a mental health team. Sorry, I've got loads of questions, and I'll come to you, Gareth, in a sec. Sorry, they call you as a mental health contact, but that is likely to be where they're reaching crisis points. So how do you stop that from being so downstream and make it upstream so that people are contacting these front doors before they reach crisis, so that they can address those?
If I may, I could come in on that as well, because again, that's key to the priority model. So that's back to the awareness and prevention awareness. So if you understand what frailty is and what the syndromes that are part of frailty, so when people become more at risk of falling, for example, our GPs and primary care are then really working on scoring. So looking across their practice population, and this is why we've got a more primary care rooted model, to say, right, this is someone who is having recurrent urinary tract infections. Actually, they are having problems with balance, and there is a frailty scoring, and then the frailty model comes in at the point of mild frailty to start connecting them, because, for example, strengthening your core through Pilates, that's actually really important, and these sorts of things, or connecting to a falls assessment, or having your glasses checked because bifocals might be causing a problem or something. And so that frailty model is tiered in that way to start with. How do you pick things up earlier? But it starts with the individual and families being aware that something might be changing, or how to stay as well as possible for as long as possible.
And have you thought about how you could potentially use county councillors? Because we are like in our communities, and there's like 70 million of us. No, 70 of us. There's, we're everywhere, and we have a lot of intel, and we share a lot of intel. Is that something to leave with you?
I would love to. So, your member development days, we'd love to come and sort of talk about new models of care which are emerging, or come to Scrutiny, and particularly 111+2, I think is really exciting, and we'd love to share more information about that. And just to answer your previous question as well about how you stop people just coming through at a point of crisis. When we first set up 111+2 back in April, we were seeing more and more crisis. What we've been doing since then is developing relationships. And we've only got 10 members of staff working on this, so it's not as though you're going to be speaking to an enormous call centre. Relationships are being built, and we're finding that people ringing back, checking back in, particularly also a number of young people have formed a relationship, checked back in, and to seek a little bit more support and advice, and to give some feedback on what had happened. So Paris is really relational, isn't it? And what we've got to do in how we do services is relational. It's about people at the centre, and then building support around that.
Yeah.
But if I can come and talk about
I think we could ask for a member development to be tagged on to something which is going to be here in County Hall. Can we have it at, on a, full council meetings are never short. But can we have it, in person? Is there a way, can I have that as a recommendation? Yeah, okay. Gareth, sorry, I've been talking way too long. Go.
Yeah. Can I just add to what Amanda's just said? It's not just the county councillors, there's 100 and whatever it is, community councils, and they are the eyes and ears of the communities. I think they're essential. But just picking up on the frailty, because I'm in a position now, I've got members of my family that are, and I think I'm approaching it as well, you know, the member of the family doing that. But my question is, what process or what activity, what communication are you're planning to do to make sure people who are fit stay fit for longer?
So I think this is for us where the RPB really should has a huge role to play, because, and this is the shift to prevention. So and why we need to build our awareness of frailty and the things that we can all do. Quite frankly, we, you know, it's why we're saying intergenerational frailty isn't just an age well issue, it's a live well issue, because what are the people in their midlife doing that will help them stay fitter for longer? So I'm not saying we've got all the answers yet, but what we're saying is intergenerational. We've built awareness and prevention into the model, and this is, we feel, you know, the RPB is well-being as well, and therefore, you know, we feel that this is key there.
And just linking to that, how would you involve children in that process? Because I always just think children are the greatest informers of information to their older generation.
Well, and I say we went to speak to Startwell, and we are saying we've got these age focuses, but there's something where we've got to have this intergenerational join up across the RPB as well. And we had fantastic conversation with Startwell. We presented them all the ageing population, frailty work, and, you know, children, young people very close to their grandparents, very close to their families, often have been cared for by, you know, grandparents. And so there were, this is emerging work, so I haven't got all the answers, but we have made part of doing this work, talking to young Startwell as well about this is what we face. You know, I think these are huge issues for the young people of Powys, you know, where they growing up and going into work in a place which is at the forefront of ageing. You know, we do have to think what that means as well.
Hayley?
Yeah, I was just going to offer in terms of that more deeper dive that might be helpful for us to organise, that in particular our Director of Public Health and the work that we're doing on the public health protection agenda. I think we could share that, because again, there's opportunities to use the county councillors, the town councillors and community councillors to up the awareness of what we've already got in place on in offer. And I think also it might be really quite helpful for us to pick up particularly inequalities, which is a key issue we're all struggling to deal with at the moment. We know the sort of systemic impact of the pandemic as having a greater impact on certain parts of our population. And I think we should again share much more information with you about the work that we're doing around health protection and prevention.
And just as a start of that, we've set up a meeting for the Director of Public Health to talk to the RPB. There's the Public Service Board as well, but we feel the RPB is key.
Okay, thank you. Councillor Shan, did you want to add?
Yeah, it was just to give a quick example of the way in which the RPB is focusing on, well, focus might be the wrong word, it's about, you know, this really comprehensive look at of systemic change. So one of the major pieces of work going on at the moment, joined up multi-agency pieces of work going on, is looking at systemic change around healthy weight, people's healthy weight. And the workshop I was at yesterday, which is part of, you know, a series of workshops that's been ongoing for over a year now, we started this last year, was looking at breastfeeding. And it's going right back to the very, very beginning of life to build people's resilience from the very beginning. And how do we expand and increase rates of breastfeeding? And it's also looking at working with mums who are pregnant, you know, to help them be prepared for this and help understand what's going on for them. Again, going back to the what matters conversation, finding out what people's experience actually is, rather than lecturing at them and placing the individual blame for obesity and overweight and things like that on individual people and talking about them making the wrong choices. It's much more about understanding how the system kind of funnels us into habits that aren't helpful for us.
I think there's loads more that we could ask on this. You know, I've got questions on housing reform and upskilling unpaid carers, and you know, the breastfeeding point again, just from my knowledge of the Welshpool Family Hub, apparently the breastfeeding group that it only meets in Costa Coffee, which is slightly problematic in terms of inclusivity. So I would love to have a member development on this, and if we could make that happen, and we could have it so it's not just really high level, but maybe we could have themes within it. That would be great, because I think members would be really keen to be involved. I can't see any other hands up. I'm really conscious of time because I know Carly's team have been here a while. Is that everything that needs to be in the public one? Yeah. Therapeutic, I think, needs to be in private. So no, so thank you so much for coming and giving that presentation. And we'll move that forward. Right, I need to work out where I am on my agenda now because we're jumping around. Sharon Powell, I can see you're online. Thank you for coming. I'm just conscious that we've got Carly and who are your colleagues, Carly? Neil. Oh, Neil. John Thomas. I know you've all been here a while. Would it be Sharon, how are you from time? I'm just wondered if we should do the North Paris wellbeing stuff before the therapeutic attachment.
Yeah, that's absolutely fine. If you want to juggle it that way around, that's absolutely fine with me.
Okay, right. Well, we need to decide to go into private session. I think we've heard the reasons why North Paris Wellbeing Hub needs to be in private. Sharon, are you able to just give a quick overview for the public as to why the therapeutic attachments presentation should be in private session?
Yeah, that needs to be in private session really because of the complexities that sit within that particular team. Really, it's not in the public interest to kind of explain the situation of that team currently in terms of the dynamics, etc., that sit within it.
Is that from a workforce perspective?
Yeah, from a workforce perspective.
Okay, I'm happy to propose that. Members, has anyone got any issues with that? No.
Just going to second that.
Yeah, okay.
Chair, could I just read out the resolution?
Yes, please.
It would be to consider passing the following resolution. Resolved to exclude the public for the following items of business on the grounds that there would be disclosure to them of exempt information under categories 2 and 3 of the local authorities access to information variation Wales Order 2007. And if there could be a proposer and a seconder, please. Okay,
am I able to propose it, or can I? I've got Councillor Chris with his hand up. Are you proposing, Chris? I presume so.
Yes, Chair.
Yep, and Gareth has already seconded.